Hello, I'm Matthew Wesson. I'm the Clinical Director of the Stress and Trauma Centre. I've been working in the field of mental health for nearly 20 years. I spent much of that time working with armed forces personnel, as I myself was in the military for some 21 years. I helped serving personnel not only with the effects of trauma and PTSD, but also common mental health problems such as depression, anxiety, stress, anger management, alcohol problems, performance enhancement, and many more. I'm a cognitive behaviour psychotherapist who's fully accredited with the BABCP, which is the National Association for CBT in the UK. I'm also an EMDR consultant accredited with the National Association of EMDR in the UK and Ireland, along with being what I think is an enthusiastic, friendly, caring and confident psychotherapist. I'm also a skilled supervisor, trainer, presenter and author in psychotherapy and health promotion. I now run a small private practice in the northwest of England with clinics in Chester, Crewe and Tarpley, where I see private referrals and provide supervision for other clinicians. Now, I realise that there are many therapies out there and counselling approaches on offer, and this can be confusing, especially when some are claiming cures in just a few sessions. The difference is I only use approaches backed by scientific evidence. All the treatments I use have been through extensive scientific trials, and as a result they're now backed by national and international organisations such as the World Health Organization and the National Institute of Health and Clinical Excellence, or NICE. They're used by various organisations such as the NHS, the MOD, Bupa, the Priory, amongst others. Today I want to use this short video talk to give you an introduction to the main two treatment approaches I tend to utilise in my clinics. That is Cognitive Behaviour Therapy, or CBT for short, and eye movement desensitisation and reprocessing, or EMDR as it's often known. So let's start with some explanation about CBT. CBT is a talking therapy that can help people change how they think, that's the cognitive part, and also change how people behave. Unlike some of the talking treatments, it focuses mainly on the here and now problems and difficulties. Years of research has shown that it's probably the most effective therapy available anywhere, and it's used for treating many emotional and psychological problems. In short, it works, and it can work with most anxiety disorders, depression, work stress, phobias, panic attacks, anger, alcohol problems, low self-esteem, insomnia, and even physical health problems like pain or fatigue. The list is too long to mention here. So how does it work? Well, CBT can help make sense of overwhelming problems, and it does this by breaking them down into smaller parts. This makes it easier to see how they're connected and how they affect the person. These parts are the situation itself, the problem, the event, the difficult situation, the thoughts, the emotions, the physical feelings, and the actions or behaviours. Now, there are helpful and unhelpful ways of reacting to most situations, depending on how you think about it. The way you think can be helpful or sometimes unhelpful, and CBT can break vicious cycles of altered thinking, feelings and behaviour. So when a client can see the parts of this sequence clearly, they can change them and so change how they feel. CBT aims to get the client to a point where they become their own therapist and work out their own ways of tackling these problems. So what does CBT involve? So together with the client we look at thoughts, feelings and behaviours to work out if they're unrealistic or unhelpful and how they affect each other. This is often called the formulation, and we continue to work on this throughout the therapy. Collaborative work is the key. We work together to begin to change unhelpful thoughts and behaviours. We work as a team, as although I know a lot about CBT, I acknowledge the client is the expert in their own world. Together we form this team to overcome the problems facing them. Now, I know it's easy to talk about doing something, but much harder to actually do it. So after identifying what they can change, homework will be agreed on between the two of us. So the client can go away and practice these changes in their everyday life. Depending on the situation, it might start with learning to question self-critical or upsetting thoughts and practice replacing them with more helpful or realistic ones that we've developed through the sessions. It might be getting the client to recognise when they're about to do something that will make them feel worse, and instead use one of the strategies we've worked on that will be more helpful. And at each meeting there will be a discussion on the progress since the last session, about how the homework's gone, and also feedback about how helpful this last session was. I may help with suggestions if any of the tasks have seemed too difficult. The strength of CBT, I feel, is that the client can continue to practice and develop these skills long after the therapy is finished. This makes it less likely that their symptoms or problems will return. And that fact's also backed up by the science. Compared to medications such as antidepressants, you're much less likely to relapse if you have CBT, because through the whole process you're learning to become your own therapist. So now let's hear a little bit about EMDR, or eye movement desensitisation and reprocessing. EMDR is a powerful psychological treatment method that was developed by an American clinical psychologist called Dr. Francine Shapiro back in the 80s. She first published clinical research data to support its benefits back in 1989, and since then there's been a wealth of research conducted demonstrating its benefits in treating psychological trauma and PTSD, whether it be arising from experiences such as war, childhood sexual or physical abuse or neglect, natural disasters, assault, surgical trauma, road traffic accidents, workplace incidents. It's effective with all of these. And since its original development, EMDR has also been increasingly used to help individuals with lots of other issues, including phobias, anxiety, pain management, bereavements, low self-esteem, phantom limb pain, performance anxiety, depression, and many others. EMDR has been found not only to be helpful for adults but also children, for those with learning difficulties, clients with language barriers, or for clients that can't or don't want to give specific details of their traumatic experiences. So how does it work? Well, when a person is involved in a distressing event, they may feel overwhelmed, and therefore their brain may be unable to process the information like it would a normal memory. Therefore, this distressing memory seems to become frozen in the brain at a neurological level. So when a person then recalls the distressing memory, they experience it or re-experience what they saw, heard, smelt, tasted, thought, or even felt at the time of the original experience, and this can be quite intense. Sometimes the memories are so distressing that the person tries to avoid thinking about them, to avoid experiencing those distressing feelings. Some find that distressing memories come to mind when something reminds them about that distressing event, or sometimes the memory just pops into their mind without any kind of warning. Others don't really create a link to a direct memory in the past, but sense that they continue to struggle to move on from past events, and those events still seem to be shaping how they react in unhelpful ways in the here and now, even though they know these original incidents happened years ago, or maybe even back in childhood. The alternating right to left stimulation of the brain with eye movements, with sounds or with taps that are used during EMDR seem to stimulate the frozen or blocked processing systems of the brain. It allows the brain to process these memories like normal memories, and hence they tend to lose their intensity and become less distressing. EMDR allows the brain to do what it's usually capable of doing, process memories and file them away in the past. The effect is believed to be similar to that occurs during rapid eye movement sleep, when your eyes go rapidly left to right as it processes the day-to-day events that happens. It also may be that getting you to concentrate on something such as left-right stimulation whilst thinking of the distressing past memory stops the brain from shutting it off, stops the brain from being overwhelmed, and allows it to process it properly and process the distressing aspects of that memory. It can also help reduce the distress in many kinds of ways. It can be processing distressing images, sounds, smells, tastes, body sensations, distressing thoughts or distressing beliefs that come from the past. It helps clients move on and leave the effects of these past events where they should be, in the past. Now, it is difficult to explain, but after 12 years of using it, I'm still amazed at the results it can bring about, often in much quicker time frames than standard therapy. My clients are often blown away by the really positive effects it can bring about, and it can often work where other therapies have failed. So that's an intro to CBT and to EMDR, so that's enough for me for now. If you want any further information, please don't hesitate to look up my website, www.stressandtrauma.co.uk, where you can find more information about the subjects we've talked about today, links to the national organisations, information about the Stress and Trauma Centre, and also some more details about me and my private practice. So I hope you found this useful, and take care. Thank you.